The Dogo Argentino, also known as the Argentine Mastiff, has an interesting and relatively recent history. Its life story begins in the early 20th century in Argentina, where it was developed by a physician named Dr. Antonio Noers Martinez. Dr. Martinez and his brother Agustin were passionate hunters and desired a versatile hunting dog that could handle various game, including wild boar. They envisioned a powerful and courageous dog that would excel in tracking, hunting, and holding down large prey until the hunters arrived. To create such a dog, Dr. Martinez crossed several breeds, including the Cordoba fighting dog, now extinct, Bull Terrier, Great Dane, Boxer, Spanish Mastiff, and a few others. The breeding program aimed to combine the best traits from each breed to produce a fearless, athletic, and loyal hunting dog. After many years of selective breeding and careful selection, Dr. Martinez successfully developed the Dogo Argentino breed. In 1947, the breed was officially recognized by the Federación Sinologica Argentina, Argentine Kennel Club. The breed standard was established, and efforts were made to promote the Dogo Argentino both within Argentina and internationally. Initially, Dogo Argentinos were primarily used for hunting purposes. They excelled in various roles, including big game hunting, tracking, search and rescue, and even as police and military dogs. Their athleticism, strength, and loyalty made them versatile and dependable working dogs. Over time, the Dogo Argentino gained popularity as a family companion due to its friendly and protective nature towards its human family members. They are known to be good with children when properly socialized and trained. However, it's important to note that the Dogo Argentino, like any other breed, should be acquired from reputable breeders who prioritize health, temperament, and responsible breeding practices. Proper training, socialization, and care are essential to ensure they grow up to well-rounded and balanced dogs. While the Dogo Argentino has gained recognition and popularity around the world, it's worth emphasizing the importance of responsible ownership. Potential owners should be prepared to provide proper training, exercise, and a loving environment for this active and powerful breed. Today, the Dogo Argentino continues to thrive as a hunting dog, working dog, and beloved family companion, embodying the vision and dedication of Dr. Antonio Noers Martinez and his desire to create a remarkable and versatile breed. The Dogo Argentino is a large and muscular breed with the following average height and weight ranges. Height. Males typically stand between 24 to 27 inches, 61 to 68 centimeters, at the shoulder. Females, generally slightly smaller, ranging from 23 to 26 inches, 58 to 66 centimeters, in height. Weight. Males typically weigh between 80 to 100 pounds, 36 to 45 kilograms. Females generally weigh slightly less, ranging from 70 to 90 pounds, 32 to 41 kilograms. It's important to note that these are average ranges and individual Dogo Argentinos may vary in size. Factors such as genetics, diet, exercise, and overall health can also influence a dog's height and weight. Raising a dog involves providing proper care, attention, and training to ensure their well-being and happiness. Here are some essential aspects to consider when raising a dog. Puppy-proof your home. Before bringing a new dog home, make sure your living environment is safe for them. Remove any hazardous items or substances that could be harmful to the dog. Ensure that electrical cords, toxic plants, cleaning supplies, and small objects are out of reach. Provide a balanced diet. Feed your dog a high-quality, age-appropriate dog food that meets their nutritional needs. Consult with a veterinarian to determine the appropriate portion sizes and feeding schedule based on the dog's age, size, and activity level. Fresh water should always be available. Exercise and mental stimulation. Dogs need regular exercise to stay healthy and happy. Take your dog for daily walks, provide opportunities for playtime and interactive games, and consider activities such as obedience training, agility, or fetch. Mental stimulation through puzzle toys, training sessions, and socialization with other dogs is also important. Veterinary care. Schedule regular veterinary checkups to ensure your dog's health and to stay up to date on vaccinations, deworming, and preventive treatments for fleas, ticks, and heartworms. Your vet can also provide advice on dental care, spaying or neutering, and any specific health concerns. Socialization and training. Proper socialization from an early age is crucial for a well-adjusted dog. Expose your dog to various environments, people, and other animals in a controlled and positive manner. Enroll in puppy training classes or work with a professional dog trainer to teach basic obedience commands, leash manners, and good behavior. Provide a safe and comfortable living space. Create a designated area for your dog with a comfortable bed, appropriate toys, and access to shelter from weather conditions. Consider crate training as a safe space for your dog and for travel purposes. Regularly clean and maintain the dog's living area to ensure hygiene and prevent odors or parasites. Love, attention, and bonding. Dogs are social animals and thrive on love and attention from their owners. Spend quality time with your dog, provide affection, and engage in activities that strengthen the bond between you. Regular grooming, including brushing their coat, trimming nails, and cleaning ears, can also be an opportunity for bonding. Remember, each dog is unique, and individual needs may vary. It's important to observe and understand your dog's behavior, body language, and preferences to provide personalized care and address any specific requirements they may have. When it comes to understanding a dog's behavior and actions, paying attention to their signs and body language is key. Dogs communicate through a combination of vocalizations, facial expressions, body postures, and tail movements. Here are some common signs and actions displayed by dogs and what they might indicate. Tail wagging. A loose, wide tail wag often indicates a happy and friendly dog. A stiff, high tail wag may indicate alertness or dominance. A low, tucked tail suggests fear, anxiety, or submission. Ears. Relaxed ears held in a natural position usually indicate a calm and content dog. Erect and forward-facing ears often show attentiveness or curiosity. Flattened or pinned back ears can indicate fear, anxiety, or aggression. Barking and vocalizations. Different types of barks can indicate various emotions or needs. A high-pitched, repetitive bark may indicate excitement or alertness, while a deep, growling bark can signal aggression or warning. Whining. Whimpering or howling can indicate pain, discomfort, fear, or loneliness. Body posture. A relaxed and loose body posture generally indicates a calm and content dog. An upright, stiff posture with raised hackles, the hair along the back, may suggest aggression, fear, or arousal. Crouching or low body posture indicates submission or fear. Facial expressions. Relaxed facial muscles, open mouth, and soft eyes generally indicate a friendly and relaxed dog. A tense or wrinkled forehead, closed mouth, or narrowed eyes can indicate fear, anxiety, or aggression. Bared teeth or raised lips with a growl can be signs of aggression or warning. Play behavior. Playful actions such as play bows, front end lowered, rear end raised, bounding movements, and wagging tails are common during playtime. Dogs may engage in chasing, mouthing, wrestling, and take turns being the chaser or the chassis during play. It's important to remember that interpreting a dog's behavior requires considering the context, individual personality, and overall body language. Additionally, some behaviors may differ between breeds or individual dogs. If you're unsure about a dog's actions or if you have concerns about their behavior, consulting with a professional dog trainer or a veterinarian who specializes in behavior can provide further guidance and support. Determining whether a dog is happy or sad requires a careful observation of their overall behavior, body language, and context. While dogs cannot express emotions in the same way humans do, they do exhibit behaviors that can indicate their emotional state. Here are some general signs that may suggest a dog is happy or sad. Signs of a happy dog may include loose and relaxed body posture. A wagging tail, particularly if it is wide, loose, and accompanied by a relaxed body. Bright and alert eyes. Ears in a natural position or slightly forward. Open and relaxed mouth with a relaxed or slightly panting tongue. Playful behavior, such as jumping, wagging, and engaging in social interactions. Willingness to eat, play, and engage in activities. Signs of a sad or unhappy dog may include Tucked or lowered tail. Ears pinned back or flattened against the head. Avoiding eye contact or having a dull gaze. Closed or partially closed mouth. Reluctance to engage in activities they usually enjoy. Excessive panting, drooling, or pacing. Withdrawn behavior, hiding, or seeking solitude. Loss of appetite or decreased interest in food or treats. Whining, whimpering, or excessive vocalization. It's important to note that these signs can vary depending on the individual dog and the situation. If you suspect your dog may be unhappy or exhibiting concerning behaviors, it is recommended to consult with a veterinarian or a professional dog behaviorist to assess the situation and provide appropriate guidance and support. Like any living being, dogs are susceptible to various diseases and health conditions. While Dogo Argentinos and American Staffordshire Terriers can be generally healthy breeds, they may be prone to certain genetic or breed-specific conditions. Here are some common diseases that can affect dogs in general, including these breeds. Hip dysplasia. This is a common condition in which the hip joint doesn't develop properly, leading to joint instability and potentially causing pain and lameness. Progressive retinal atrophy, PRA. It refers to a group of genetic eye disorders that cause progressive vision loss and can eventually lead to blindness. Heart disease. Certain heart conditions, such as dilated cardiomyopathy, DCM, or mitral valve disease, may affect dogs, causing symptoms like coughing, difficulty breathing, and exercise intolerance. Allergies. Dogs can develop allergies to various substances, including food, environmental allergens, like pollen or dust mites, or certain materials. Allergies may result in skin irritation, itching, hair loss, and recurrent ear infections. Hypothyroidism. This condition occurs when the thyroid gland doesn't produce enough thyroid hormones, leading to symptoms like weight gain, lethargy, hair loss, and skin problems. Cancer. Dogs can develop various types of cancer, including lymphoma, mast cell tumors, and bone cancer. Signs can vary depending on the type and location of the cancer. Deafness. In certain breeds, including Dogo Argentinos, hereditary deafness can occur. Dogs may be born deaf or gradually lose their hearing over time. It's important to note that not all dogs will develop these conditions, and responsible breeding practices can help reduce the risk. Regular veterinary checkups, a balanced diet, exercise, and proper grooming can contribute to a dog's overall health and well-being. If you have a specific breed or dog in mind, it's always recommended to research potential breed-specific health concerns and consult with a veterinarian for personalized guidance. Most of the diseases commonly affecting dogs are not directly contagious to humans. However, some conditions can potentially be transmitted or have zoonotic implications. Here are a few examples. Allergies. While dogs can develop allergies, the allergens themselves, such as pollen, dust mites, or certain foods, are typically not contagious between dogs and humans. However, humans can also be allergic to some of the same substances. Skin infections. Bacterial or fungal infections that affect a dog's skin, such as ringworm or certain types of dermatitis, can be contagious to humans. It's important to practice good hygiene and take precautions to prevent transmission. Parasites. Dogs can harbor various parasites, such as fleas, ticks, and certain types of worms, like roundworms or hookworms. These parasites can be transmitted to humans and cause health issues. Regular parasite prevention and proper hygiene are essential to minimize the risk. Leptospirosis. This is a bacterial infection that can affect both dogs and humans. It is typically transmitted through contact with contaminated water or soil containing the bacteria. Precautions such as avoiding stagnant water and practicing good hygiene can reduce the risk. Rabies. Rabies is a severe viral disease that affects the nervous system of mammals, including dogs. It can be transmitted to humans through bites or scratches from infected animals. Vaccination programs in many countries have greatly reduced the incidence of rabies in dogs. It's important to note that these examples are not an exhaustive list, and the risk of transmission can vary depending on the specific disease, the individual's health, and other factors. If you have concerns about a specific disease or suspect your dog may have an illness, consult with a healthcare professional or veterinarian for guidance and appropriate measures to ensure the health and of both your dog and yourself. The treatment for specific diseases in dogs will depend on the condition and its underlying cause. It's important to note that I am an AI language model and not a veterinarian, so the following information is for general knowledge purposes. For accurate diagnosis, treatment, and guidance, it's always best to consult with a qualified veterinarian. Veterinary care. If you suspect your dog is ill, it's important to take them to a veterinarian for a thorough examination and proper diagnosis. Veterinarians will assess the dog's symptoms, perform necessary tests, and provide a treatment plan tailored to the specific condition. Medications. Many diseases in dogs can be managed or treated with medications prescribed by a veterinarian. This can include antibiotics to treat bacterial infections, antifungal medications for fungal infections, and medications to manage pain, inflammation, or specific symptoms associated with the condition. Surgery. In some cases, surgical intervention may be necessary to treat certain conditions. This can include procedures like spaying or neutering, tumor removal, orthopedic surgeries, or other specialized surgeries depending on the underlying issue. Therapies and lifestyle modifications. Depending on the condition, certain therapies or lifestyle modifications may be recommended. This can include physical therapy for dogs recovering from surgery or with musculoskeletal conditions, dietary changes for dogs with specific dietary requirements or allergies, or behavior modification techniques for dogs with behavioral issues. Ongoing management and follow-up. Some diseases, such as chronic conditions or those requiring long-term management, may require ongoing treatment and regular monitoring. It's important to follow the veterinarian's instructions regarding medication administration, follow-up appointments, and any recommended lifestyle adjustments. Remember, the specific treatment approach will depend on the diagnosis made by a veterinarian. They will provide you with detailed instructions on how to treat and manage your dog's specific condition to optimize their health and well-being. Dogs, including Dogo Argentinos and American Staffordshire Terriers, require a balanced and nutritious diet to maintain good health. Here are some key points to consider when determining what to feed your dog. High-quality commercial dog food. Look for commercially prepared dog foods that are specifically formulated to meet the nutritional needs of your dog's life stage, puppy, adult, or senior. Choose reputable brands that use high-quality ingredients and meet the nutritional standards set. Wet or dry food. Both wet, canned, and dry, kibble, dog food options can provide complete and balanced nutrition. Wet food often contains higher moisture content, which can be beneficial for dogs who don't drink much water. Dry food can help promote dental health by reducing tartar buildup. You can choose one or use a combination of both, based on your dog's preferences and your veterinarian's recommendations. Consider breed and size. Different dog breeds and sizes have varying nutritional requirements. Large breed puppies, like Dogo Argentinos, may benefit from diets specifically formulated for their growth needs to prevent developmental issues. Consult your veterinarian for guidance on the appropriate food for your specific breed and size. Protein, carbohydrates, and fats. Dogs require a balanced mix of protein, carbohydrates, and fats in their diet. Look for dog foods that list high-quality animal protein sources, such as chicken, beef, or fish, as the primary ingredients. Like grains, vegetables, and fruits provide energy, while healthy fats contribute to skin and coat health. Avoid harmful ingredients. Avoid dog foods that contain artificial preservatives, flavors, and colors. Some dogs may have specific dietary sensitivities or allergies, so it may be necessary to select foods that are free from certain ingredients like wheat, soy, or corn. If you suspect your dog has food allergies or sensitivities, consult your veterinarian for guidance. Portion control and feeding schedule. Follow the feeding guidelines provided by the dog food manufacturer, adjusting the portions based on your dog's age, activity level, and overall body condition. Divide the daily portion into 2 or more meals to maintain a consistent feeding schedule. Avoid overfeeding, as obesity can lead to various health problems. It's important to note that individual dogs may have specific dietary needs or health conditions that require a specialized diet. Consulting with a veterinarian is crucial in determining the most appropriate and balanced diet for your dog's specific needs. They can provide personalized recommendations based on factors such as age, weight, health condition, and activity level.